In today's lecture, we will be discussing the highlights of the topic of parenteral nutrition, often referred to as total parenteral nutrition or TPN. By definition, parenteral nutrition is the provision of nutrients necessary to maintain health by delivering them intravenously. The significance of this type of nutritional delivery is the fact that it can be done without a functional or accessible gastrointestinal tract. Parenteral nutrition is indicated for use in the severely malnourished, patients suffering from major trauma or burns, enteritis as a result of radiation treatment, extreme diarrhea, pancreatitis, issues with the stomach and bowels, extreme nausea and vomiting, or unsuccessful attempts to provide nutrition via the enteral route. A good example of this in my own practice was with a patient who suffered from short gut syndrome. With short gut syndrome, there is insufficient function of the small intestine in the absorption of nutrients from food consumed via the enteral route. Therefore, in order for the patient's body to receive adequate nutrition, the gastrointestinal tract had to be bypassed. Components including proteins, carbohydrates, lipids, electrolytes such as potassium and sodium, vitamins and minerals, trace elements, and on occasion certain medications. In practice, medications are not mixed in the parenteral nutrition very often. One point that is important to remember is that parenteral nutrition is intended to provide all of the nutrients required to the body to maintain homeostasis and to heal. However, this is not a perfect solution and requires frequent assessment and reformulation to meet the nutritional needs of the patient. As I said previously, parenteral nutrition is not a perfect solution for the provision of nutrients and should not be used if the patient has an intact gastrointestinal tract. The intestinal tract is a very well functioning system and is the ideal way to deliver nutrition if the patient is healthy. There is also the issue with patient satiety that must be addressed. Patients receive satisfaction from the process of eating food. When a patient is unable to tolerate oral intake, this becomes an emotional issue as well. Another consideration involves the access used to deliver the parenteral nutrition. On occasion, peripheral venous access is used to deliver parenteral nutrition. However, this is not only ideal in a very limited short-term. This is only ideal on a very limited short-term basis. Ideally, central venous access should be obtained and utilized in the administration of parenteral nutrition, especially when it is known that the therapy will be long-term. Prior to initiating parenteral nutrition, a series of steps must occur, including a nutritional screening, often performed by a nutritionist. A thorough health history should be obtained, including the patient's weight and dietary history, calculation of the patient's body mass index, a thorough physical assessment and laboratory analysis to establish the patient's baseline. Lab values of importance include electrolyte panels, protein levels, cholesterol, liver function studies, blood glucose, copper and zinc levels, and prothrombin times. These labs are reassessed routinely to assess the effectiveness of the parenteral nutrition therapy and to make adjustment to the PN formula. The nurse must also consider the patient's energy, protein, and fluid requirements when administering parenteral nutrition. For instance, a patient who is suffering from severe burns or trauma may be suffering from a large amount of fluid loss or third spacing that would require an increase in the fluid needs as well as an increase in the protein need. The nutritionist and pharmacist are responsible for dosing and preparing all parenteral nutrition. The nurse should not add anything to the parenteral nutrition solution unless ordered to by the provider. In the past, I've had to add vitamins to the parenteral compound just prior to administering the solution because vitamins are not stable if added to the PN solution in advance. However, this would be ordered by the provider. One consideration when administering parenteral nutrition includes ensuring adequate vascular access has been obtained, and if administering it through a PICC line or a central venous catheter, verification of the placement of the catheter tip is essential. As a nurse, you do not want to infuse a parenteral solution or any other solution through a vascular access device that is not in the correct place. Preparing to administer the solution is the next step in the administration process and includes verification of the solution's contents with the provider's order. Policy and procedure varies among facilities in regards to this verification, and some require that 2 licensed providers verify the contents with the provider order prior to administration. The cycling of parenteral nutrition will also be determined by the provider, nutritionist, and pharmacist, as will the decision to discontinue the therapy. Therapy is discontinued once the patient's nutritional status is stable. A few other considerations to include are the patient's glucose tolerance and the impact of stress on the patient's nutritional status. Please pay special attention to the core competencies for nurses administering and monitoring parenteral nutrition on page 456 in your textbook. Catheter and site maintenance is essential and is the sole responsibility of the nurse. Of course, the catheter site is, as we all know, a portal of entry for many infectious microorganisms. This is a given. However, when you add the administration of parenteral nutrition to the equation, this risk of infection and malfunction is greatly increased. This is because the parenteral nutrition solution composition can lead to problems such as promoting bacterial growth due to the glucose and lipid content in the solution. Parenteral nutrition solutions are also very viscous and sticky, which can lead to premature malfunction of the venous access device due to residue in the IV catheter. Monitoring and continuous assessment of the patient status and response to the parenteral nutrition is also a primary responsibility of the nurse. This includes evaluating the patient for weight gain and loss, monitoring hydration status, bowel status, laboratory results, and the patient's overall physical status. Finally, the nurse is responsible for monitoring for potential complications related to both the IV catheter and the metabolic state of the patient.